There are two different strategies available for diagnosing COVID-19 infection. The virus which causes COVID-19 is called SARS-CoV-2. Like all viruses, it's a ball of proteins and fats surrounding the genetic code which is in the form of RNA. The current test being used looks for the genetic code of the virus by taking a swab from the nose and mouth. In the laboratory, the virus RNA is first converted to DNA by an enzyme called reverse transcriptase. The DNA copy and other essential reagents are placed in tubes to perform the polymerase chain reaction, or PCR. There are then a series of repeating steps, each cycle of which doubles the number of copies of the DNA. Each time a new copy is made, a special chemical in the mixture is released and fluoresces, which the PCR instrument detects and plots on a graph. The more viral RNA in the sample, the earlier the graph will go up. In the actual test, labs look for more than one part of the SARS-CoV-2 RNA. The PCR test tells whether a person currently has live or very recently dead virus in their body at the time of the specimen collection. So why can't we test everyone? Well, this type of testing requires specialist equipment, reagents, and skilled scientists and pathologists. The pathology labs have gone from no test existing to testing hundreds of thousands of Australians in just a few weeks. But there is another type of test which may allow us to do less restricted testing using blood samples. Serology tests measure the antibodies we make in response to an infection. The first type of antibody produced is called IgM, and this may appear within days of an initial infection. IgM antibodies will become positive later than the PCR test, about 5 to 10 days after developing symptoms in the case of COVID-19. Because of this, serology tests may not be useful for patients who have just started showing symptoms. IgM antibodies fade away weeks to months after the infection has gone. The other main type of antibody produced is IgG. IgG antibodies persist for much longer in the bloodstream after recovery, for years or even lifelong. The antibody tests being developed measure both IgM and IgG anti-coronavirus antibodies. Serology tests are now becoming available and should allow for more rapid and widespread testing using a few drops of blood. Remember, your best defence is to follow the Australian government advice and maintain social distancing and good hand hygiene.